Hello, everyone, and welcome to NYC Health and Hospitals Kings County YouTube podcast. In this season, we will be focusing on cardiology. My name is Bukharovich, and I'm Chief of Cardiology and Director of Hornreich Health Center. Today here, I'm joined by Dr. Hornreich, Ms. Perelman, and Ms. Belvitt to discuss and dissect the advances in cardiology. There has been a lot of recent advances in cardiac research and understanding the mechanism of cardiovascular disease. So we would like to share with you some of the new advances in heart failure. Ms. Perelman, can you please discuss with us all the advances that came out in research?
Sure, Dr. Bukharovich. Advancement in cardiac research and understanding of the mechanisms underlying heart failure have led to significant progress in the approach to conditions like heart failure. Advances in genetic research have identified several genetic mutations associated with various forms of cardiomyopathy and heart failure. This has led to a better understanding of the underlying causes of this condition and the potential for targeted therapies. Biomarkers research have identified new biomarkers that can help in the early diagnostic and prognosis of heart failure. These biomarkers can also aid in the development of personalized treatment plans. The development of advanced imaging techniques such as cardiac MRI and 3D echocardiography has improved the ability to diagnose and characterize heart failure. Research in regenerative medicine, including stem cell therapy and tissue engineering, holds promise for repairing damaged heart tissue and improving heart function in patients with heart failure. The advancement of remote monitoring technology and telemedicine has enabled healthcare providers to closely monitor patients with heart failure, adjust treatment plans as needed, and intervene earlier when complications arise. Artificial intelligence and machine learning technologies are being increasingly utilized to analyze large databases, identify patterns, and personalize treatment strategies for patients with heart failure. New drug therapies, including those targeting novel pathways involved in heart failure, are being developed and tested, offering potential alternatives for patients who do not respond to traditional treatments. These advancements have collectively contributed to a more personalized and comprehensive approach to managing heart failure, which focuses on early detection, targeted interventions, and improved patient outcomes. As research in cardiac resources and understanding of heart failure mechanism continues to evolve, it is likely that further breakthrough will lead to even more effective strategies for preventing, diagnosing, and treating heart failure.
Thank you, Viktoryia. There were great points. And in the last decade, there have a lot of advances has been made in genetics and research in heart disease and medications from it. Leading from that, Dr. Hornreich, can you discuss a little bit more about advances in amyloidosis, the treatment, and genetic testing for it?
Yes, thank you, Dr. Bukharovich. I'd be happy to do that. In our practice, we have recently started to test patients for genetic evidence of a condition called amyloidosis, which is related to abnormal proteins being produced in the body that then deposit into the heart, causing the heart to eventually fail. The exciting part about this is not only can we do the genetic testing and find that the patient has a propensity for producing these proteins, but we now have treatments becoming available that can actually reverse these conditions, which in the past sometimes could be extremely rapidly progressive to end-stage heart failure and even death.
Thank you, Dr. Hornreich. That was an excellent overview of the recent advances in cardiovascular disease. We have it available in our Heart Health Center that we serve minority population, mostly Afro-Caribbean and Afro-American, who are disproportionately affected by this disease. Ms. Belvitt, can you discuss a little bit more of the other diseases in this population that we see in our practice?
Cardiovascular health in the minority populations, such as African American, is a specific area of focus, especially since there is a higher incidence of risk factors for cardiovascular disease, such as hypertension, diabetes, obesity among this group. The risk factors can contribute to the development of cardiovascular conditions. The minority population may also face barriers to accessing higher quality healthcare, which includes preventative care, treatment of cardiovascular problem. These barriers can lead to delays in diagnosing and also inadequate management of the risk factors and result in poorer health outcomes. One major barrier is socioeconomic factors such as lower income, which can result in limited access to healthier food and lifestyle choices, which ultimately can affect the cardiovascular health.
Thank you, Ms. Belvitt. You brought up a very important point that affect our population, and I want to bring out that our Heart Health Center is open 5 days a week, and we have a comprehensive approach of addressing both medical, diagnostic, and psychosocial options for our patients, and bringing the comprehensive and diagnostic approach to their care. And also the advances that we have. Dr. Hornreich, can you describe any breakthrough devices that has occurred recently that we can offer to our patients and increase their quality of life and their improvement in cardiovascular health?
One major device that's revolutionized cardiac care in the last 10 or 15 years is the development of what's called an implantable cardiac defibrillator. This device is similar to a pacemaker, about the same size. It is implanted into patients who have weakened heart muscle, that have cardiac failure, and may be subject to what we call sudden cardiac death, what the average person on the street would call dropping dead. We can now use this device to monitor the patient's heart continuously, and just as if they had a paramedic with them, the AICD, it's called, will monitor the heart and administer a shock and keep the patient from dying. And this has had a dramatic impact on patients of all strata and helps to save lives. We even have what's called a life vest, which can be utilized to transition a patient before they get the major device implanted surgically.
Thank you, everyone, for this very interesting and detailed discussion about the advances in genetics and devices in cardiovascular health. Thank you, Dr. Hornreich. The information that you brought up is very interesting and exciting, and the information that was brought up by the whole panel today highlights the development and advancements in the field of cardiology over the last decade with development of new genetic testing, medications that are now on the market that we can treat the cardiovascular diseases, and the device technology that helps to monitor the heart and improve the quality of life of the patients. So thank you, everyone who listened to this podcast. I think you got a lot of useful information from it. Any questions that you have, please reach out to the Heart Health Center, and we'll be happy to see you. Thank you.